Welcome back to a new year of Resolutions for Recovery. I hope each and every one of you had a wonderful summer, a healthy summer, and put into some of the practices that we went over in the spring for your adolescent and younger children, for that matter. Today we're going to continue educating on substance use disorder, and we are very thrilled to have in the house Rob Kent from Office of Alcohol and Substance Abuse Services and Chief Counsel. He's got a lot of titles, but Rob's a rock star, and I'm so thankful that our paths have crossed because so many things had to change, and unfortunately, so many lives have been lost in order for the change to occur.
Well, thanks for having me.
Oh, anytime, anytime. You're a wealth of information. So I don't even want to waste any time getting, so many people are still struggling, certainly in the state of New York, but all over the country. But New York is leading the way with very innovative things. So if I am a family member in the state of New York, whatever loved one I have that's struggling, we always talk about young adults, but it could be anyone.
Yeah.
We can go to Oasis's website,
right,
and we'll make sure that we have everything up on the website for everyone to look at. But we can see what beds are available, right?
We see all treatment.
All treatment,
yeah, absolutely.
in New York State.
So we set up a couple years ago, we call it findaddictiontreatment.gov. And actually, if you go to our website, and I'm sure you'll put that all up, it's right on the top of the first page you go to, the home page. And literally you can click on that box, it'll pull up a search device, and you can check by zip code, by proximity to that zip code, I think up to like 50 miles, and it'll tell you the available treatment. So both bedded programs, in outpatient and methadone or opioid treatment programs, it'll tell you whether they have available treatment capacity that day. And the beauty of it is it's set up, our providers feed the information, they report at least once a day about what's available, and they can update it as frequently as they want. And it's interesting because other states we found have created things like this, but it's what I'll say is behind the curtain. They use it for their own purposes, but they don't make it publicly available. So as far as we know, we're the first to make something like this publicly available. And we did it because we hear so many different stories, right, about how people in crisis will try to find out how to get help. And we felt like it was one of the easiest ways of making this available. You can do it in the comfort of your own home. You can get on the internet, go to the Oasis homepage, and it'll take you right to the contact information for those programs, and you can do it that way. Or there's
want to
ways.
Add on your website, and I'm so proud to have been a part of that. But there's the kitchen toolkit on how to talk to your other siblings or your younger children about substance use disorder. But also there's so many videos there to educate yourself on substance use disorder if you think your loved one may have a problem.
So we created, there's two web pages. One is right on our own, one is a separate governor's web page called Combat Heroin.
Yes.
But then we also have one which is called Combat Addiction. Again, there's a box at the top of our homepage. You can click on that. And it's exactly that, Linda. You can get video, you can watch videos, you can get materials to read. You can read on the while you're there scrolling through, and it's everything: how to get help, how to have the conversation, things to look for to maybe make you concerned if you are concerned, everything. And we also, one of the things I really liked, it was an interesting thing. So after we did some legislation in 2014, the first start of what we really started to do to make it easier for people to get help, we created this work group of providers, insurance companies, consumers, family members, And one of the things that came out early on, and it was actually from a managed care, a medical director of a managed care company.
Which is interesting.
Yeah, but she said, you know, sometimes when people are in crisis, they can't even read something.
Correct.
So why don't you tape really short videos explaining everything, what to expect when you show up at a treatment program, how to appeal if your insurance company denies. Our medical director, Charlie Morgan, speaks about what, you know, medication-assisted treatment. And so it's literally A to Z. So you can watch short 2 to 3 minute videos
in the
to educate yourself.
Because unfortunately, the shame and stigma is still so rampant with the disease. And when you're in crisis, speaking from a family member's point of view, you're scared to death.
Yeah.
And you're frozen. And fear sometimes will just keep you in that place. So if you can educate yourself a little bit and also have all the numbers right there.
Yeah, you can do it in your own privacy of your own home. And I will tell you, like, you talk about the stigma, and so the next thing that we're really excited about, and actually we're going to premiere it next week at our annual providers conference. So we have filmed so many people and gotten so many stories from people of recovery.
I'm excited about this.
So we created a 1-hour documentary. Well, our folks who created it call it a movie, whatever that means, but it's called Reversing the Stigma. And what I like to say is that unlike a lot of these documentaries that are out there about this heroin opioid epidemic, where it seems like they focus in and connect you to these people and then they overdose and die at the end. That happens, but we're going to show you particularly 2 or 3 people, and we're going to follow them over the years that we've been working with them.
That's awesome.
And they're in recovery. But you know what? We felt like one of the things we liked about it, it's honest, because it's not all, you know, glory and wonderland and beautiful.
And it's not easy.
They struggle.
They struggle every day. They struggle every day.
So you'll see that, and you'll see them as they're in their life at this point.
I think for people watching right now too, relapse is not failure.
No.
Relapse is just your disease kicking up again. You know.
Right.
That's all it is.
Addiction is a chronic medical condition.
Yes.
Just like diabetes, heart disease, asthma. People don't think of it that way because we're still dealing with this sort of mythology that it's a lack of will, it's a lack of volition, right? But there's a physiological aspect to addiction. You become dependent on that medication, and it impacts everything in your life. Just like, by the way, when you have diabetes, it's like type 2 diabetes. So that's self-induced, right? You type 1, you're born with it.
Correct.
Type 2, you get there because you don't eat well, whatever.
You don't eat well, you don't exercise, you don't do all the...
But people don't follow the regimen every day. But we don't treat them like we treat somebody who has a drug or alcohol addiction who doesn't follow the program every day. And so we continue to work at that. And our view is the more we show people, first off, the biggest thing with this movie for me was that everyone doesn't die. Too many have died, but you can recover from this. And, and you know what? You will struggle some days. We all struggle.
We all struggle some days.
And it was great. One part of the movie, there's a guy that's being interviewed, and he talks about people living their authentic life, right? And that's whatever it was meant to be. So we're excited about it. It's just one more piece of what we're doing.
It's so important to really showcase.
Yeah.
So, you know, but we have people, I don't know why when famous people get into recovery, it's just such a, you know, there are millions of people every single day that live next door to you that struggle with addiction that don't broadcast it, you know, and maybe they should, maybe they shouldn't. That's their own personal.
Their choice.
Their own personal choice, and we're not going to judge or criticize anybody. However, it's a daily walk that they have to do, and some days are better than others.
Right, and I think you'll see that in the movie. People are honest and talk about some days just really weren't all that great.
Some days just aren't
all that great. Some days aren't all that great for all of us, right?
I have amen to that, that's for sure. You know, in New York State, though, so sometimes folks think that by putting a lot of miles, I have to get my loved one out of here because it's all the triggers in here.
Yeah.
That's what the big problem is. My advice or my 2 cents worth is you can always find a drink, drug, or a potion or a substance anywhere you go if you're looking for it.
Yeah.
So it's not so much because the proximity, because the family must get involved also in the journey with their loved one. So you want to be in close enough proximity to be able to share in that journey with them, because the whole family must recover. That's why I like about keeping people in New York State. But if I live here, I have to drive 6 hours to get to Saranac Lake by Lake Placid, New York. That's a lot of time and miles, right? Between
people. It is. And we spend, you know, and as you know, so I can say the following, you know, we have treatment available every day. We have beds available every day. Are they down the street from you? Probably not. But are they within an hour's drive? Most likely. You can find treatment, and it's good treatment. And but we also, while we think we have enough treatment, we're always looking to add capacity in certain areas because it's not equally distributed. There's no doubt about that. But that's when you build a system over years based on providers stepping up and doing it, some areas step up, others don't. And then there's the simple fact that, particularly in rural areas, you can't cite programs because, you know, not to be crude, but there's not enough people to support the staff to run the program.
Correct.
So, but there are programs all over, and we're continuing and continually trying to add capacity where we need to, where there are gaps, and we'll continue to do that. So, but there is treatment available every day. And to the out-of-state thing, please stay in New York. I'm the lawyer for the agency that oversees these programs. We license them, we inspect them, we have people in at least once a year. We have a system set up where if something goes wrong, a patient's abused or neglected, there's the Justice Center. Reports are made, they're investigated. Our oversight over our system is such that I'm confident saying that you should stay in New York. And by the way, if you do want to get way far away, I told a mom this once. I said, so she lived in Western New York, almost near the Pennsylvania border.
Okay.
I said, so I can get you to Carmel. It's in New York, though. It's in Putnam County. It's 6 hours away from you. So there you go. You can go to treatment in Carmel. It's just not in California. It's in New York.
Correct.
So, and it's a good program. It's Arms Acres. And there are great programs everywhere. The reality is you don't get into this business to make a killing financially. You might
do not.
In other states, you don't in New York.
Correct.
So you're in it because you care or you have a personal reason. So there's treatment every day. I can't implore your viewers enough, if you really are in need, that Find Addiction treatment, that resources on combat addiction. And then there's all these other resources we're continuing to add all throughout the state.
And I think what people need to understand is at some point in time, your loved one's coming back to New York State. So you need to, that's why the whole family needs to strengthen all their tools in their toolbox. And you need to have someone in New York State that can also step you down with services in your area that's going to give you a full and comprehensive recovery, because recovery doesn't start at that 28th day when they shake your hand and they say good luck to you. There still needs to be wraparound services. It's a long process, and you need to have a bunch of people that are waiting and willing to envelop you in this recovery movement.
Absolutely. The family's a major part. Now the reality is, my observation, my experience, most people don't show up by themselves. They're usually with their family when they come to get help. The family's part of the treatment. And in fact, and it's something we're working on, because it's in the law that treating the family can be part of treating that individual. You can treat them separately, because there's an impact on them, as you know. I
Huge impact on them.
When somebody's actively in the throes, it's 24/7.
Yes.
You are in crisis. You're consumed with it, and it has an impact on you. It has an impact on your brothers and sisters.
Physical,
yeah.
You know, your whole being gets
Right.
affected.
And so we've been working really hard to get our providers to focus in on working with the families. Now, look, there are instances, quite honestly, where the family is the problem or they're
Absolutely.
contributing. But
Absolutely.
it is such a rare instance where the family's interfering with the person's ability to get better. And in fact, most of them won't get better if the family's not engaged. And so we're working on ways with our providers that we can get the families more involved. And you know, through Thomas's Hope, and there's other entities, we're trying to figure out how we engage all these family support organizations that have developed over the last number of years to maybe bring them into the process and have them do the work for our providers who are focused more on the individual who's actually addicted to the substances. But you know, as you know, everything
takes time, and
but we keep working at it.
We keep working at it, one day at a time.
Yeah.
You know, and that's the way we're going to build it. So I'm excited because we talk about going out of state, and I know too many families who have thought that they were their loved one was going to be safe in different states, and unfortunately they passed away. You know, they were worse off than when they left here, and the family got huge bills. I'm talking $100,000 in that vicinity. So what is New York State doing about that now?
So a number of things. Also connected to that is what we're calling patient brokering. What we found is there are people running around this state who have relationships, let's just say that, with out-of-state providers, and they literally get paid, well, they call them referral fees, I call them kickbacks. Mm-hmm. If they refer somebody to an out-of-state provider, and they have relationships with them, and the person has private insurance, because then the insurance will pay it for it as an out-of-network benefit.
Correct.
Yeah. And they're getting paid like thousands of dollars off of the insurance,
anywhere from $3,000 to $5,000 per head.
Right. And the problem is the programs these people are linking up with are not good programs. I get the calls from the families where it didn't work, which is too often.
Yes.
And then we got to try to find them help when they come back to New York.
With no benefit.
Well, here's the reality. If you have an insurance policy with an out-of-network benefit, they have to allow you to go where you want. And usually it's in the range of the insurer will pay 80% of the cost, and you're responsible for 20% of the cost. But there's an annual and lifetime limit on those out-of-network benefits for your whole policy, not just addiction issues.
Correct.
So we hear stories. Here's a scenario. The family goes out of state. The individual goes to a program. The program charges in the neighborhood of $40,000, $50,000. So you're responsible for 20% of $50,000.
$10,000.
So, you know, and what then we hear is families second mortgage their houses, they borrow from their retirements, or they take their savings, and they end up, you know, with no more insurance coverage. Person's not well, back in New York in need of help. Now, we'll get them help, by the way. I will find a way to get somebody in a program if we hear about it. And we've done it too many times. But we just spent $50,000 on terrible treatment when you could have found a bed, if that's what was needed, in New York State. And even if it was a couple hours away, it's better than a plane flight away.
Right.
And our programs work. They help people recover every day. And so we're really focused on two aspects of that. One is the fact that people are getting kickbacks. That's illegal.
That's illegal.
And we're going to start going after people who are doing that. And we've issued some letters recently. I have, as the lawyer for the agency, that you can't do it.
Website too.
You cannot do it. If you do it,
And
it's
Florida
against the law.
has passed a very strong law.
That's where most of them were going,
Yeah,
in
and
all
that's
honesty.
where most of them were going. So with reciprocation to New York State.
Well, they're saying don't send them here anymore,
Right.
which about time. But
Yeah.
but that's okay. Late to the ball game, they're still in the ball game. But yeah, it's a problem. So we're trying to stop the kickbacks, right? But what we also want to do, so think about it. If your insurance company, and I'll give you an example. So I was told by a governmental person at a county level, I won't say where, that they had 4 employees in their county government go out of state for addiction treatment last year. $700,000. So the insurance, so when you think about why your premiums are going up,
Right.
as far as I'm concerned, it's not because we've changed all the rules about no prior authorization to get into care in New York for inpatient, and we've made access easier.
Yes.
That's not why your insurance is going up, because the newsflash, those people who get in now because when they need to and want to, you're saving the money for when they end up, when you wouldn't let them in crisis, in a hospital,
Yes.
in an emergency department, in a hospital bed for months, in all the medical conditions that they have that get exacerbated because you didn't treat
Exactly.
the addiction. So I'm trying desperately to work with the insurance companies, because we believe there are questions their folks could ask when a member calls and says, I want to send my son or daughter or whoever to an out-of-state treatment program. That would maybe, as long as they don't tell them you can't go
Right.
and you don't need treatment, but if you need treatment, how about we work with you to find you a place within our network, within New York State.
Saves
that-
the family money.
Yeah, and it saves the insurance company money.
Saves the insurance company money.
So, and it's
then
good treatment.
We can do some step-down treatment, save that money that maybe there'll be co-pays for.
right.
Or, for a sober living facility.
The thing is, in New York, we have the continuum. I can't speak to what other states have. So in almost every community, you can find outpatient services, which is what you need after you come out of a bedded program. And as you know, we're thrilled to death, because now what we've started to add is these recovery centers, and we
Yes.
just came from Thrive.
From Thrive right over here in Hauppauge.
So that's a
We need
recovery
two more
center.
of those on Long Island.
But we had to start somewhere, and we'll
We
go
did,
from
and
there.
It's an amazing facility.
So we're trying to create these supports so that people can live a life in recovery, and there are supports for them, and they can be engaged and connected. I'll tell you, one of the things that strikes me, I keep saying this to folks, when I talk to people who are in treatment programs, 'cause I go to programs all over the state, my view is visiting them, going there, talking to people, that's how you do your job better from my perspective.
Absolutely.
But so often what I hear, especially from young folks, is they're alone. They're not connected to anybody or anything. They don't play sports. They come home, and it's no knock on anything, but both parents work, they don't eat dinner together, the parents
Right.
will come home late. There's no connection. They get isolated.
Yes.
And then
of
they
course
get
we have this.
Right. And my son's right with the PlayStation, and they connect people virtually.
Yeah.
But it's not a connection.
No, it's not a human connection.
Right. And and so many of the folks that I've met recently who reached the point where, it might be they found friends to connect with, but they were the wrong friends.
Right.
And they were using drugs, and these kids got caught up in drugs, and they got addicted and became dependent. But so much of it is they're not connected to anything.
Yeah.
And so that's why the family's important.
Families always,
And
families still,
yeah.
and it is unfortunate. 2 parents working, everybody's so overwhelmed.
Yeah.
That's the word for today's
Well,
lifestyle.
I tell you what, so I have 2 boys, 21 and 18, and I don't know the right way. I just know my way. So
Right.
I take them to events with me. They've met a lot of people. They've met kids who are in recovery, kids in treatment. They've met parents whose kids are in treatment, addicted. They've met parents who've lost their kids. And so it has an impact. I mean, I still believe we're the strongest influence on our kids.
You know, and they actually did on Long Island with, I think it was 600 kids that they interviewed, okay, just through a ballot, and who parents were still the #1 influence, and their coaches. Whether they played a sport or not, which was interesting, they would go to a coach, whether it was their coach or not their coach. So we need to empower those
Well, I know you've done
are,
some work with coaches, and we try to do some. Yeah, they're huge influences in a school, absolutely.
And I still, you know, there needs to be that human, you know, our children today have problems that we are not addressing as important to them, but they're big in their life.
Yeah. So,
and adults need to acknowledge that's an important.
Absolutely. But I will tell you too, like, so I talk to our clinical folks at Oasis. They tell me the single biggest indicator of somebody succeeding in treatment is that therapeutic connection with their counselor. So another human being, the connection with other human beings is a key to helping people get better. So, and I'll tell you another thing that we're really focused in on. What we're finding as well is people who wouldn't normally go to treatment are starting to consider it more, because we've been trying to ramp up and get providers to use certified peers. So people who are living a life in recovery are having a huge connection with people and in convincing them to get better and get help.
So we'll be right back after this message, and we will start to talk about some certified peer recovery coaches and family advocates. We'll be right back.
First you stole prescription pills from your mom. You threw back a few, and then they were gone. So you're jonesing real bad, yeah, you need some more. So you call a shady guy and say you're looking to score. And that's how you got addicted to heroin. He came over quick, said he got something new. For just $10 you snort or chew. Said just one time and then you'd be fine. But soon you OD'd and now you're dying. And that's how you got addicted to heroin. And that's how you OD'd on heroin.
Yeah, this will make all those bad feelings go away.
I always make things better. I'm like the best friend who's always there.
You know that isn't helping you. What are you talking about?
Don't listen to him. Who's your friend?
He'll be your only friend if you keep that up. But she left me because they left me because
they left you, but I didn't. Is that friendship or what?
He's the reason they left you, Mark. He didn't want to go anywhere anymore. He just wanted to sit at home and get high.
Don't listen to him, Mark. You're just hallucinating.
And why are you hallucinating? Are you telling me you'd rather isolate yourself in this drug-induced dreamland? Why?
Mark, don't do it. You need me.
The only thing you need is you, Mark. The longer you sit at home and shove those things down your throat, the further you slip away from everything.
Mark!
You don't own me.
I'm not a drug addict. I am not in denial. I am in control. Are
you really in control? Help is one call away.
Welcome back to Resolutions for Recovery. Gio, if you can put the flyer up, our third annual Walk for Recovery is going to be at Marjorie Post Park in Massapequa on the 24th of September, which is a week from this coming Sunday. And please come out 3 p.m. to 6 p.m. Things to do for young children, resource tables, music, food. Everything is free. Just come out and join us and unite for recovery, and recovery is possible, and hope is always available. Thanks. Thank you, Gio. So we're back with Rob, and we started to just touch on some certified peer recovery coaches. So that's what we were talking about, which kind of, to me, in a 12-step fellowship would be a sponsor.
Right. They're a little bit, they
have a little bit more training.
Right, but, right.
Is that?
So I will tell you, so one of the things that I've come away with in the last year is one sort of offshoot of this patient brokering thing is there are people running around, and so I want to say this politely. I think there are a lot of people trying to help others. So their motivation is right. Very few, I think, that
motivation is pure.
Right.
How they do it is not.
But the issue is, so, and I just issued a letter from our office because there's what we call certified recovery peer advocates, and I'll explain what they are in a minute. There's recovery coaches.
Yes.
And then there's interventionists.
Yes.
And some of them have gotten themselves caught up with this kickback stuff, and it looks impressive. They produce a piece of paper, it's a certificate from some entity that certified them to be these things. But there's a huge difference. And what I picked up over the last number of months in particular is there's a lot of confusion.
Yes.
Even in our own provider world about who these people are and what they can do. So the Certified Recovery Peer Advocates is something OASIS created. They have training, they get trained as well, and very importantly, when we created this thing on ethics and boundaries, because we think that's most important, because they're in recovery themselves. Sometimes they get too close to the people they're trying to help, yes, and the lines get crossed, and it's not an appropriate thing to have happen, and it leads to really bad consequences. But so we have 2 entities in New York that we designated, OASIS designated to certified peer recovery advocates. They can be used in our treatment programs. They do not provide clinical services. They provide support, recovery support.
Hand-holding.
Yes, and they help people. So
be a friend.
You know what, if the person is struggling with something in their life, their job is to try to help them figure out how to overcome it, right?
Right.
How to connect them. But be clear, you can connect them to treatment, but you can't get paid for it.
Correct.
So we created that. There's about 500 of them. We need more. We're working on them because they really do work. And they can also, within our OASIS outpatient programs, some of the work they do with patients, the providers can bill insurance, Medicaid and private insurance, and get reimbursed. So
okay,
that they are the gold standard of what we're doing. Then there are these recovery coaches. There are entities that certify them.
Mm-hmm.
They are not certified by OASIS. The certification has no meaning for OASIS. Doesn't mean they shouldn't be out there doing things, but we find some of them now are engaging in quote unquote a private practice. They have no authority to do any of that. And then so there's a role for recovery coaches, and I get there are entities that certify them, but in terms of oversight of them, there really isn't any. And in terms of them being able to enter into a private practice, that's not blessed by any entity that's certifying recovery coaches. And we try to make those points. We try to tell people.
So don't pay them cash
Right.
or by check.
Right, they can't do clinical stuff either. It's
Right.
non-clinical support services. They're a coach, right? They're trying to help you. They're trying to teach you
They're a life
how to do
coach.
things, life skills, whatever it might be. And then there's these interventionists. Same thing, not blessed by OASIS. It's not a service our programs provide. We don't oversee it. There are people who've been legitimately trained. They also have they're a licensed clinical social worker. They have
Correct.
another license or credential, and they work with the family to intervene, to get the person to go get help, and to help the family through that process. And then after they go to treatment and after they get out, that's a true intervention.
And an interventionist, a true intervention takes a long
Oh,
time to
yeah.
put together.
Yeah.
It's not, you call somebody, they come over, and they get your loved one to get on a plane
It's
to go
not what you
somewhere.
saw on the A&E
No.
network.
It's not anything like
No.
that. It's a very structured, procedure, and it's
Yeah.
going to take quite a few weeks to get all the points put together.
Oh yeah, you've got to get the family prepared to have
Yes.
the intervention, and then they have to be there to help make it happen. But it's as important they help the family through the process,
Yes.
both beginning, after the intervention, going to treatment, and then after treatment. That's what a true intervention
That's
is.
what a
and
true
there are people who
yes.
do that.
Yes.
But it's not something OASIS oversees or licenses. So
Correct.
our concern was there are people out there, whether it's with true intention or motivation or pure motivation or intention or otherwise, who have no competence to do some of the stuff they're doing, and they're not helping families and people with need for services.
And what I've heard too is that sometimes, unfortunately, they show up at these 12-step fellowship meetings
Oh, yeah.
and say, "Oh, I can get no. This is not the right place for your loved one to be. Let's stop this treatment plan, and I'll get you someplace
Well, I've heard
better."
they've pulled people out of treatment programs, which is mystifying to me, but we're going to go after them.
And it's also dangerous.
Yeah.
You pull somebody out, they're disconnected from treatment, and that's when they're most,
Yeah.
at
they're
risk.
playing on the following. So when your
Fear.
loved one
Yeah.
is actively abusing heroin or opioids, especially what's out there right now, it's lethal.
Yes.
You are desperate. And, unfortunately, a lot of times when they reach out, they hear, "I can't help you."
Right.
So when somebody says, "I can help you,"
Yeah.
that's music to their ears. And that's, there are ways to do it, for people to do it properly, not get kickbacks, not make referrals to programs
They
other than the
also
right
say,
program.
I can get you insurance in another state that's, and that's insurance fraud.
Oh, I've heard of examples. I get it fourth or fifth hand, where they've taken New Yorkers to Connecticut and got them an Affordable Care Act policy that the provider paid for, the out-of-state provider paid for, because the cost of buying the policy is far less than what they'll get paid to treat the person. Remember I said, could be a couple $100,000. And within that, that's what they pay these folks as a referral fee, kickback, to refer people. And by the way, we know who some of them are, and we're going to start going after them. And we've cold called some of them. And it's interesting. So
Yeah.
we've had people call and say, "Well, I desperately need help, but I'm on Medicaid." And they said, "Well, you should go to the OASIS Find Addiction treatment site." Literally, we had that said to us. But then if you tell them you have insurance, they ask you for your policy, what insurance company, and then they tell you, "Well, I know a program that I can get you in tomorrow, and we'll fly you down there." And we've already talked about what happened. So
Yeah.
there's, unfortunately, right, part of this world, if there's crisis, there's opportunity.
Yes.
Opportunity to do the right thing, and opportunity for people to do the wrong thing and make a lot of money at it. So we're trying to stop that. because we're trying to put all these other resources in place so that people can do it with the right way. I would encourage anybody, if you think your loved one needs help, I would take them to the nearest outpatient program.
Correct.
Get them assessed.
Yes.
We'll figure out how to get them connected. Our providers can figure that out.
You know, the one question, just ask, are you licensed by Oasis?
Right.
Period.
Right.
You know?
And you know, the other thing that we've talked about, or a couple other things I'm really excited about, which could help with this, we're trying to create these 24/7 open access centers. And we just put a procurement out last week. Every area of the state will be eligible to submit a proposal. We're going to fund one
on Long Island. We have Talbot House and we
Right.
have New Hope in Nassau County, you know,
Right.
and they are not being utilized right now.
But what we're trying to create is a place that's open 24 hours a day, 7 days a week. It's not a treatment program. But what it is a place where treatment programs can send staff to staff the program, and they can get their assessment. And then with the linkage and cooperation with the providers who staff it, then get connected to the right program. Beauty of it is it will be open 24/7. Every region
So
of the
could
state,
police-
including Long
Could
Island.
the police bring people directly there if they were?
Absolutely. Let me give you a great example.
That's a beautiful thing.
We started one, actually two, in Staten Island. So the DA in Staten Island, who was also on the governor's heroin opioid task force, Michael McMahon, he came to us last fall and he said, look, I've convinced the NYPD precinct captains in Staten Island that if you create sites that are open round the clock that we could bring people to, we will stop arresting people who we would charge with like low-level criminal possession of a controlled substance. So these are, by the way, that's an amount so small, you're using, you're not selling.
Correct.
So what they do now, and it's actually been operational since January, they will tell the person, I'm going to arrest you or I'm going to give you an opportunity. If you meet with a person from one of these facilities, they're going to come here, by the way, to the precinct, and you engage in getting help, whether it's treatment, other services, we won't process the arrest. We'll give you 30 days to meaningfully engage in treatment. And so started in January. Since January, I think over 250 people have been offered this opportunity. About 230 of them accepted. And I think 20 or so were rearrested over like a 6-month period.
That's a great percentage, though.
Yeah.
You know, and the thing is with substance use disorder, especially opioids and heroin, you're going to get clean, you're going to jail, or you're going to be dead.
Right.
That's the three options that you have.
It's,
So jail is not always a bad thing.
no, but
Because it's a roadblock. But if
Right.
we can skip that roadblock, because now we have a lot of young people that may have some kind of a criminal record, and when they do get into recovery, they can't get a job.
it's
then.
hard. Yeah, absolutely
It's,
hard.
you know, it really affects the rest of their life. So we need to open more doors.
Well, and you know, so opportunity. The opportunity here is that law enforcement all over the state is thinking like DA McMahon in Staten Island and the NYPD. We are tired of arresting the same people
Yeah.
for minor crimes.
So we don't want to go back to the Rockefeller drug laws.
No, they are mindful of the fact that their jails are being filled with nonviolent people who really
Yes.
aren't criminals. They have an addiction and they're feeding it by breaking the law. And so this program holds great promise. So we'd love to see something like that in Long Island. The other thing these places will be is a place where families could bring somebody because we
Anytime.
tell our providers,
That window opens for a second.
Right.
And if there's a place, get in the car, we're going to go here. We're not going to
And
the
you know what?
emergency room. We're going to go right here.
It might be 2 a.m. on a Saturday.
Yes.
So we need to have we need our system. We've been working really hard. People don't get sick or decide to get well or decide to get help 9 to 5 Monday through Friday.
Correct.
So we've been working with providers. We're in a whole different
And
ball
I
game.
get
You have to change
Many a
the
call
way you
on
do
Friday
business.
afternoon at 5:30.
Right, and we've talked, and
Yeah.
we get people into our state facilities.
Absolutely.
Because
But it's when you have somebody that's so afraid to go through the weekend because they don't know if that's going to be their last weekend.
I tell people, I don't want this. Well, we can get you in on Monday.
Right.
I want to get you in when you call me.
Yeah.
Because because the reality is, most people who say I'm ready are not 100% ready. And so the reason we changed the insurance laws on inpatient, because we used to get these stories, person decided to go get help, usually with their family, they'd go to an inpatient program, and they'd sit in the waiting room for hours waiting for approval.
I've done it.
They start to withdraw.
They start to withdraw, and then
or they go out and use, quite honestly.
You're not high enough for treatment. That one still always gets me. You're not high enough for treatment. What should we do? Go outside and he should shoot 6 more bags? What does that mean to me?
That should never be said by an OASIS program, because it's just flat out wrong. You bring the person in, get them started. If you're not the right place, you're supposed to assess regularly, get them to the right place, but don't let them leave. I told our providers, I don't ever want to hear someone say to me it wasn't meant to be. That's our fault when that happens. That's not their fault. We can't, right now, it's like, so we work with providers, you know, sometimes they'll say, well, I have a person, if I keep them, I'm going to be over capacity by a bed. I said, the answer is always keep them. Yes, is the answer. If you need to go over for a couple days, don't let people leave your programs. When people leave, the stuff they're using right now, they will kill themselves. Yeah. And we're not going to let that happen. So we work every day. Look, our providers they're under siege as well, right?
They are under siege as well.
This is impacting staff. The epidemic we're up against, the viciousness of the drugs they're dealing with right now, and how addictive and how just sucked in they get you.
We haven't even seen, in my humble opinion, the tip of the iceberg. Yeah. Because now we're going to be, there are children left as orphans that grandparents are raising. There are babies being born dependent that our healthcare system in this state, we haven't even begun to fathom the cost of raising that baby.
Right.
And all the services that child will need.
That actually is something we're looking at, because, I mean, we're faced now with grandparents raising their grandkids because their kids died.
Kids died, or they're incapable.
Or they can't take care for them. So we are looking at that, to be honest. These kids.
The babies, the infants are born, they're going to have
We're looking at both
issues.
things. But I will tell you, so I came to this realization. I ought to have known it. I probably did, but like recently, that we're doing everything we can as the Addiction Oversight Agency, and it's not enough. And there are other parts of this society, of government, of healthcare, who need to step up, because it's way beyond at this point just the dealing with the addictions. There's all these offshoots. You just mentioned the families and the deaths and what it does to raising children. The babies who are born to mothers who were using opioids at the time, you know, those are things we need to start dealing with, but they're not just OASIS issues.
Right. It's not going to government, police, but everyone needs to come together. We all need to come together and really face everything, you know, utilize. I mean, I'm going to say it again on the website, PAL, Cub Scouts, you know, Girl Scouts, everything is there to do a presentation. You don't have to reinvent or invent anything.
Oh, absolutely.
Just use the material that's there. It was very
Well, you talk about the kitchen table toolkit. So
absolutely.
Peggy Bonneau, my colleague, created this, but everything we've created, I mean, we work for the people.
It's free.
It's on our website. Take it, use it.
Yes.
There are video educational series on how to have the conversation with your kids, how parents to have the conversation.
That age needs to be very young. You know, and you don't need to speak about drugs, but we need to speak about coping skills, you know, life skills, all of those things. And to that effect, how many recovery high schools will we have?
So we're going to start with 2. We put a procurement out.
Yes.
And procurement just went out. We're trying to identify 2 communities to work with over the next year to develop the right model. Our view is that they got to run through the BOCES, because BOCES,
Yes.
as we know, are regional. There's multiple school districts. We don't
The
think every school
infrastructure's there.
district, right?
Right.
And actually, the BOCES in certain parts of the state are very motivated to do this. They do mental health stuff now.
Yes.
So we're going to look for 2 proposals that come from the BOCES, even if it's one BOCES, or if it's a partnership with multiple BOCES to create a broader reach. But it's got, so I got to be clear. So BOCES will do the educational piece.
Okay.
Treatment providers will do the treatment piece. And this model drives off of our system, and the way we reimburse in our system pays for the treatment. The educational piece is paid for how school districts fund BOCES, right? They pay
Correct.
tuition, I believe, for kids who go there. The normal state aid formulas, whatever they are, because I'm not an education guy, will fit. But I'll tell you, one of the reasons we're doing this, and it's not new. I mean, Minnesota's been doing it for like
right.
30 years.
Texas,
Massachusetts,
Yes.
Texas. Here's some stats that we got. We do our own survey of kids in high schools. 95% say they can access drugs and alcohol through their networks in the schools.
Absolutely.
So then take that stat. Now take this stat. Kids who leave their school to go get treatment and come back, 70% relapse. In areas where there's recovery high schools, 30% relapse. So 70 to 30. So we know it works.
Right.
So we've got to try it. Again, there's a point at which schools, so I learned this actually working with the governor's heroin opioid task force. We had a school superintendent on, Tom O'Brien, great guy. And he told me financially for a school district at a certain point, I think he said it was around age 19, there is no financial incentive any longer for the school to educate that 19-year-old. So we can't have these kids age out of school, right?
No, we can't.
Because, so you're going to end up addiction, history,
Yeah.
and no high school education. What are we expecting is going to happen? So,
Then there really is that no hope.
right.
There is
right.
that no hope. You have.
Well, we've set
you have
people
an
up at
18
19.
Or 19-year-old
Yeah.
who, if they started to abuse substances at age 14, they have the mental capacity of a 14-year-old. The emotional capacity,
No.
because they do stop growing.
There's other things that we can do too, though. So this is one approach, but the way we've set up our system where our outpatient providers can go outside their clinics to provide services, we think they could do that and start maybe engaging with schools generally. Go right to the specific schools if they think there's an issue in that school. And actually,
Every school district has an issue.
Long Island is the only area. So William Floyd School District
Yes.
has an outpatient provider, outpatient OASIS provider on the grounds in the facility. Not saying that's the right approach, but that could be done elsewhere. And there's also, so we talk about—
Northport High School
Yeah.
has Anthony Ferradino, who's a CASAC, who's a
Right.
social worker, who's
Right.
on staff there.
And then we have some of our residential treatment programs for adolescents, like Outreach here on Long
Outreach
Island.
in Brentwood.
They have a BOCES school
Yes, they
in
do.
the treatment
They have
program.
state-of-the-art school
I just
there.
visited there
Yeah.
a couple months ago, and I gotta tell you, so I just was struck, this one kid because the kids take you on the tour.
At Outreach?
Yeah.
Yeah, I know. They're
so the
awesome.
one kid who led it, he told me he had been in like 4 treatment programs in
And
the
he's all
last
of
3
16.
years. And he got way behind in school. He went to Outreach. He caught up, and he graduated in June, and he's going to SUNY Albany. So if that hadn't been there, he wouldn't have graduated. So he comes out of treatment, and he's going to age out.
Correct.
And he's not going to get educated. And
Right.
it's just,
And
so
it-
now this
and
kid
it-
has hope.
Yes, it leads to that hopelessness Never mind that the disease, substance use disorder, whispers all the time.
Yeah.
You're not good enough. Why don't we go get high? Why don't we go do this? That little voice is always there. So we need to fight the little voice.
We need to help people.
Yes.
It never ends.
Especially our younger generation. Yeah. It's just never ending. And we have to give them hope and a future.
Well, and
I think every high school should be a sober high school. That's just my, I think we need to set higher standards.
A lot of them think they are.
Yeah.
But I mean,
the reality is,
you know it. We go still to do forums in schools, and you will still occasionally. I hear what you're saying, but that's not a problem in this school district.
Correct. When a football coach in a high school knowingly allows his team to go to a party every weekend where he knows that there's underage drinking, that's a problem.
Yeah.
Because you've already given them the green light.
Yeah, and as you know, we know some really good prevention providers. It's modeling. What are you telling kids, right? And it starts young. And our prevention programs, I mean, we have great programs that we don't have anywhere near the reach.
Kim Laube, who I love. I adore working with her.
I hate presenting with her because it's like,
she's
well, unless I go ahead of her.
You have to go ahead of her.
but it's interesting. She doesn't talk about drugs and alcohol.
No, she does not.
She talks about making good decisions, right? And she
talks about a family health policy.
Right.
What's your family health policy?
Right.
Your community and your community norms.
What I've heard her talk about, the only time your kids see you laughing or having fun, do you have a drink in your hand?
Right.
And if it is, what are you modeling? She's not saying don't drink, but she's saying, think about the impact. You are, again, we keep saying it, we said it earlier, you are the single biggest influence on your loved ones, on your kids. Absolutely. Good and bad.
I can't believe that we're coming up to the end of the hour. Thank you so much, Rod.
Thanks for having me.
Because you're a wealth of information. We can't thank you enough for all the work that you do, because I know you work tirelessly. And that doesn't go unnoticed by anybody, especially me.
Thank you.
So we will continue the great fight. September 24th, 3rd annual Walk for Recovery. Join us, and we'll see you next week. Have a great weekend.